and insert a probe all the way through. That way you can follow it and you don't have to stick your finger up there and try to figure out where it's coming from. Ultimately, you're learning human anatomy, not sheep anatomy. So their aorta and their pulmonary trunk is a little bit different. So I think the best way for you to know it that would actually help with human anatomy is to remember that the pulmonary trunk comes from the right side of the heart, and we can see that really clearly once this is inserted, that it came from that side of the heart to which it's pointed. Whereas the aorta comes from the left side of the heart. So it becomes really easy because ours don't have that same configuration, so there's no point in memorizing that. So that'll be there, and so I would ask, you know, which vessel is this, and so you say, oh, that's the aorta, and I know because I can see which direction it's coming from, so it would kind of look like this. The other thing that's going to happen is this is going to be completely folded back and pinned hard down to the dissecting tray so that we can get at some of the other structures. Now, when you look inside this, and I don't even know if yours are cut small enough that we can see it, sometimes on this you can see a few of the pulmonary valves. You can on theirs. Never put them on this. They're too small, they're too difficult to see. So in both the aortic and the pulmonary semilunar valves will be on the model only, so you can scratch them off on the sheep heart. The other thing, as I mentioned to everybody, is that they always chop off the pulmonary veins. That's why we have this huge hole on the back of the heart. So scratch that off. I'm not going to put that there. We do have very distinctly I think this is just a rib. This is the actual superior. Now, theirs, they just have a hole, but on this one, I want you guys to look, or if one of you guys wants to bring it over, I can show you the inferior as it should be. So this is this heart, and here we can see the superior pretty nicely, but we can also see the inferior. Okay? So just double check, you know, pull it out when you look at it and make sure whether it's the back, the one that's all the way at the back, which is inferior for a sheep, or at the top, which is superior. So we can put those on there. Then it's just knowing the sides of the heart. You know, these are the ventricles, right and left, the atria, right and left. The interventricular septum, you can see here it's been a little bit destroyed. Here it's a little less destroyed. Okay, then we have our valves. So you can see in both of these, all these structures. See those little cords? You can see them here, and then you can also see them in this one. Those are the valves. That's what they look like, and it's very similar in a human heart. And so again, this one's on the right, so it's the tricuspid with the R, bicuspid on the left. The bicuspid, also called the mitral valve. Either one is fine. Most people use mitral, so it's fine. And then the apex and the base of the heart. That's pretty much it. So the only thing, again, is being able to recognize right and left half of the heart. If you can do that, you're good.